Welcome to H&HN Daily. I'm Hayden Bush, online editor for Hospitals and Health Networks magazine, and I'm joined today by Suzanna Hoppszallern, H&HN senior editor for data and research, to discuss the H&HN Most Wired Survey, which is open to hospitals through March 15th. Susanna, thanks for joining me today.
Thank you, Hayden.
So Susanna, why should a hospital take the Most Wired Survey this year?
Hayden, the main reason that hospitals should take the survey is for the comprehensive assessment that they receive. The Most Wired Survey has over 800 fields. We look at IT usage and adoption over a broad number of areas. We have 4 focus areas. We look at hospital IT infrastructure, business and administrative management processes, clinical quality and safety in the hospital, inpatient and outpatient, and then across the care continuum. So it's wonderful feedback as to what's going on in each of these major areas. Each of the hospitals gets a detailed, high-level results report. Then they also get specifics on what are the areas where they did not meet the most wired requirements. The second reason that a lot of hospitals like to take the survey is for the recognition. Many of them like to tout this achievement. They get a lot of favorable publicity for meeting the requirements. And then the third reason is that we look at the benchmark group and we highlight the achievements of the benchmark group throughout the year in hospitals and health networks. And we really learn from this group as to what's new on the horizon, what are hospitals getting into, and what are some of the success stories.
And Susanna, what does it take to be most wired this year? Do you have any tips on taking the survey?
Well, to really take the survey well, you need to involve, of course, your IT folks, preferably your CIO or someone in IT is shepherding the survey throughout the organization. In a small organization, they might know a lot about what's going on in the clinical areas, in the back office, in the supply chain. But in many organizations, what they do is they parse out sections of the survey to the different departments, and they get their input. And then they meet and they put it all together, and they make sure that they have a good profile of their organization. That's probably one of the more typical ways for a larger organization to make sure that they have adequate input. Another important area to focus on is infection control, because they also have a strong IT component now with the survey's focus on more of the public health sector. And what's new in the survey this year, the main thing is our alignment with meaningful use. We've taken into consideration the core measures and the menu set. While we don't require that you have a certified EHR to meet these requirements, what we do ask is for many of them for you to indicate, is it a certified EHR, or are you able to perform these functions and get this data using a clinical information system or a non-certified EHR? We're going to be looking at this data very closely over the next couple of years.
And are there any new bells and whistles this year?
Yeah, we're looking at cloud storage for the first time. Mm-hmm. We're also in the personal health record area. We're looking at not only organizations that have a personal health record through a patient portal or on their own website, but those that are partnering with a third-party vendor. And very often now, hospitals are providing patients their health information or a discharge summary with a flash drive or a CD. So we've incorporated all these little nuances into the survey.
And Susanna, I also understand there's some new material on governance this time around.
Yes. Probably one of the keys to success in the IT sector in healthcare is having a solid governance process and really having senior level management involved from the inception through the acquisition and implementation, and even further along, looking at the measures of success. Have the business objectives been met for the particular IT project? So we're taking a closer look at that. We've always looked at some project analysis. Are you looking at cost benefit, risk assessments of particular IT projects, and are you looking at the success of the actual business objective, and do you have metrics for that? We found over the years that the most wired are fanatics about measuring. They want to make sure that whenever they're deploying something that it's successful, and if the project goes awry, that they get back on track very quickly.
Well, that's all the time we have for today. Susanna, thanks for your insights.
Thank you, Hayden.
For more information on H&HN's Most Wired survey, visit www.hhnmostwired.com. Thanks for joining us today.